Brita, are you aware that the environment affects the immunity of the people?
What? Precious, I've been meant to understand that during this pandemic, the human immunity is informed across the globe.
That's so sad, Brita. There's environment that provides herd immunity as opposed to what was considered universal during this pandemic.
Ladies and gentlemen, with big health systems, Africa should be prepared for the worst of this pandemic.
But that's not us. It's just a warning from the World Health Organization.
Brita Kavete, alongside
Kigona Precious, young scientists from St. Thomas Girls, Cliffy County, are here to contradict the above warning using
environmental herd immunity modulatory system
an African model heritage.
With outbreaks of pandemics such as Spanish influenza and COVID-19, people's social lifestyles have been affected through social distancing and lockdowns. These design lockdowns have brought upon a negative impact on the global economic recession and the psychological and mental health among people.
That's shocking.
Relax. Precious.
Yes?
Are you aware that for any successful research done, research objectives are used?
Of course, yes. In our case, is to determine and postulate the missing links in the number of COVID-19 cases and the environmental modulatory factors in Africa and other continents. Not to forget,
to determine how social and environmental factors influence immune response from people in different continents.
You guys may be wondering, which research models are used, methodology of this study?
In our research methodology, we endeavor to use case studies from different countries and different continents, with Africa being the center of interest.
Why Africa?
This is to establish the difference in the acquiring level of herd immunity with reference to COVID-19.
Data from the field was collected through interviews, observation, questionnaires, and also reviewing past medical journals with reference to the COVID-19 infection.
In our research study, we focused on the African population and how its environmental settings affects and modifies immunity. 3 levels of population study were the children, the youths, and the elderly with reference to body health experience.
The African population was compared with the Asian, the European, and the American population and was found to have fewer number of cases of COVID-19 infections.
Reason for that?
This is because of the differences in their cultural settings, the environmental patterns, and also the social economic settings too. Not forgetting that many Africans have been exposed to diseases, which modulates their immune system memory.
We administered questionnaires and did interviews with medical experts at Cambridge on the COVID-19 spread and infection patterns across the continent in comparison to that of other continents. It was confirmed that Africa had fewer cases and deaths at 1.46 million and 35,000 respectively, unlike Asia, which had the highest number of cases at 10.3 million, while South America had the highest death cases at approximately 500,000 as of September 28.
According to Dr. Kijinji, a medical expert, scientist at Cambridge Cliffy, the few number of cases in Africa could be as a result of, first, the warm climate in Africa doesn't favor the replication of the virus. Second, Africa was the last continent to get the virus. Thus, people were more prepared when the pandemic hit. Not forgetting that the social cultural settings of Africa is different from the other continents, as most people in Africa live in the rural areas. That's why they have a natural social distancing.
However, Europe and Asia recorded high number of cases during the cold winter season between March and May as a result of low temperature, which catalyzes the replication of the flu virus. According to the CDC Data Bank 2020, it was discovered that many more cases were recorded during this cold winter season because of low temperature, because many people were indoors, resulting to poor ventilation and high level of contact. That's many cases. As we conclude,
the World Health Organization predicted that Africa will be hit hard by the pandemic and its health systems will collapse. But that's not the case right now. Recent data showed that Africa has had less than 40,000 death cases, COVID-19 infections.
Reason for that?
Africans have been exposed to harsh challenges such as malaria and cholera, and thus their bodies have adapted a herd immunity memory, and this has also caused the many asymptomatic cases which are not easy to detect and test. Brita,
yes?
What do you propose for the World Health Organization to adopt?
Further research should be done on how the environmental settings affects and modifies immunity response from different populations across the globe, leading to better modification of the models and the restriction measures put forth to curb such pandemics.
Not to forget
to study the African complex DNA,
African model heritage,
our behavioral herd immunity.